procedure for medical treatment of lead poisoning requires immediate evacuation from the source of poisoning and hospitalization if lead levels are above 40 micrograms per deciliter. Irreversible brain damage usually begins at 10 micrograms per deciliter, especially in children under the age of 6 whose immune systems have yet to develop. Many of the lead levels of the Gypsy children in these camps were over 65 micrograms per deciliter, the highest level the WHO machine could read. WHO staff suspected that some children, because of their symptoms, had lead levels in the 80s and 90s. As it turned out, 2 children had a lead level of 120 micrograms per deciliter, the highest in medical history. In November 2004, WHO presented their health report on the Gypsy camps to UNMIC, recommending immediate evacuation. Although there were precedents for the UN evacuating thousands of Albanians and Serbs in Kosovo when they faced life-threatening events, these Gypsies were not evacuated. The only measure that the UN took was to begin bi-monthly meetings with UN agencies and other NGOs to study the problem. Although many NGOs, including the International Committee for the Red Cross, petitioned the UN to immediately evacuate these death camps within 24 hours, no action was taken by the UN until 2006. In January 2006, the UN in Kosovo closed one of the Gypsy camps and moved 35 families to a new location about 50 meters from their old camp. The new camp was called Osterode. It was formerly a French Army NATO base in North Mitrovica, but had been abandoned after many soldiers were found to have lead poisoning. In fact, all French soldiers serving there were told by French military doctors not to father a child for 9 months after leaving the camp because of the high lead levels in their blood. Nevertheless, the UN, in their wisdom, spent more than 500,000 euros donated by the German government to refurbish this camp. Feeling that most of the lead poisoning came from the ground, the UN cemented over much of the area and then obtained a certificate from the Center for Disease Control, a US-funded agency, that the camp was lead safe. Although these camps were built on the tailing stands of the Tretka lead mines, most of the lead pollution comes through the air from the 100 million tons of toxic slag heaps in front of the camps. In September 2006, at his first press conference as head of the UN in Kosovo, Herr Joachim Rücker proudly announced that the UN was doing something to help these Gypsies dying of lead poisoning. In addition to moving them from their camps to Osterode, which he declared was not lead safe, but lead safer, the UN would begin to treat lead poisoning with a better diet. For the first time in 4 years, food aid would now be given to the Gypsies so that they would no longer have to go through the local garbage cans. The U.S. office in Pristina donated $1 million for this better diet. It is well known to medical doctors that a proper diet can lower lead levels by about 20%, but only if the affected person is first removed from the source of poisoning. In the case of these infected Gypsies, reducing their lead levels by 20% would still leave them with life-threatening levels. For the first time in 4 years, the UN also provided a daily medical staff to look after the health of these Gypsies. Unfortunately, lead poisoning can only be treated once a patient is removed from the source of lead poisoning. By spring 2006, 2 of the Gypsy camps, Žikovac and Kablar, had been closed, with more than 100 families now living in Osterode. After 3 months, blood samples were taken, and according to UNMIC, the health of the Gypsies was improving thanks to their new diet, and lead levels were falling. However, WHO and UNMIC refused to share copies of these blood results with the public, or even with the Gypsy families themselves. Later, I was given copies of the test by a disgruntled WHO staffer who was tired of the cover-up. The test results showed that the lead levels had not only risen, but that Osterode, the lead-free camp, now had higher lead levels than the 9-year-old Chessman Luke camp. In 2006, the UN announced that the only solution for these gypsies living on or near the toxic wastelands was to rebuild their homes in their old neighborhood and move them back. Thus, the UN enlisted several international donors to rebuild some of the gypsy homes and several apartment blocks with a promise to move the lead-infected gypsies back to their old neighborhood. Unfortunately, as soon as these homes and apartments were finished in the summer and fall of 2006, the UN did not give all the apartments to the gypsies living on the toxic wasteland, but mainly to Kosovo gypsy refugees the UN wanted to bring back from Serbia and Montenegro to show that their return policy of refugees was working. In April 2007, all food and medical aid at Osterode was stopped because the UN said it was running out of money. Once again, the gypsies were forced to find their only food by going through the local garbage cans. But worst of all was yet to come. Because many children at Osterode and in the adjoining camp of Česmin-Luk were showing common signs of lead poisoning, lead on their teeth, daily vomiting, and memory loss, the camp leaders insisted on new blood tests. Random blood tests in April 2008, tests of 105 children showed staggering results. For many of the children living in the UN lead-safer camp of Osterode, their lead levels had doubled since moving into the former French base. Because the UN, UNHCR, and the United Nations High Commissioner for Human Rights refused to help these citizens of Kosovo, I have appealed directly to the Minister of Health for the newly declared country of Kosovo. Dr. Alush Gashi is not only a medical doctor but also a personal friend of mine for several years. He once lived and worked in San Francisco. I not only appealed to him by email, but also visited him in his office, begging him to help his minority citizens. He understands the problem. He understands the situation. As a medical doctor, he knows that these gypsies need to be evacuated immediately. In a recently filmed interview with Dr. Gashi, he acknowledged that these gypsies should be evacuated, that they would be better off in a prison than in the death camps. He said that USAID was funding a project with Mercy Corps to save these people. It didn't take me long to get a copy of the USAID Mercy Corps project. It called for the resettlement of 50 of the 120 families living in the camps over the next 2.5 years. There was no immediate medical solution for anyone living in the camps. Evacuation was not mentioned. Later I found out that the author of the project has never even visited the camps. Yet USAID is handing over $2.5 million for this cosmetic solution. Since 2005, we have tried to force the UN to help these gypsies. An American lawyer, Diane Post, has tried to sue the UN on behalf of several hundred gypsies living in these camps. Her lawsuit against the UN at the Court of Human Rights in Strasbourg was turned down because the court declared that only a country, not an organization, could be sued. The UN does have a policy of compensation for such problems, but UN lawyers for 3 years have refused to cooperate in seeking compensation for these gypsies or resolving their health problems. The UN does not deny responsibility, but refuses to comply with its own rules and standards. In 2005, the Society for Threatened Peoples, the largest NGO in Germany after the Red Cross, brought to Kosovo the leading German expert on toxic poisoning, Dr. Klaus Runo. Although the UN tried to bar him from the camps, he was able to take about 60 hair samples from the gypsy children. He sent the hair samples to a well-known laboratory in Chicago. The results showed that not only did many of the children have the highest lead levels in medical history, but that all had toxic poisoning from 36 other heavy metals as well. In trying to defend themselves, UN personnel